So this is our patient, Maddie, and this is her head and her arms and her legs. So this is her vagina, and she is here for a labiaplasty procedure. These are the labia majora. These are the outer lips that have a hair. These are the labia minora that we're going to make smaller. And this is the clitoral hood, and here's the vagina. So the plan, because Maddie is experiencing discomfort on a daily basis from this very sensitive tissue that sticks out beyond the labia majora, is to just take this one part and make it a little bit smaller so there's not as much tissue to get in the way of her comfort, pinching, tangling, irritation when she exercises. So when patients come in for a labiaplasty, the first thing I do when I examine them is I draw on them to show them sort of what we would do if we were to trim this tissue down. And again, it's not that there's anything abnormal about these patients or out of the ordinary, it's just that it's sensitive tissue that in their anatomy happens to stick out. So I draw on them just kind of arcing down from the hood on the front and the back of the labia, and I show them sort of what the plan would be to remove some of the tissue. This is what would be gone, and this is what would stay. And you can see that that's a dramatically smaller labia. So do the same thing on the other side. And I draw on patients before surgery also, so they can, you know, have a chance to take a look and agree, and we can chat about it. So that's kind of the planned resection for the labial tissue. And we're leaving some labia behind. We don't want to take all of it. The goal is to make everything look as natural as possible. So we put some topical and then we numb them. And so now Maddie's ready to go. So I use cautery. Obviously this is a flower, so we're not going to use cautery. And I use a scalpel, but we're just going to use scissors. And I trim that tissue where we intended to trim it, because I've got my lines drawn on. And we're just trying to make it smaller, but very natural. So there's her right side. And then we come around and we trim her left side. Oh, sorry, her right side. My left side. Right along those lines, because she's numb, so she's not feeling anything. So now we have much smaller labial tissue. We take the cautery, we stop bleeding. These aren't exactly the same sutures that we use, but they're the ones that are going to show up. So now we've got these two sides to the labia minora. We need to sew them back together into a very natural looking labia. And again, these are not the sutures we use. They're much, much, much smaller. They're actually completely buried, so you don't see them. But I want you to get an idea of what bringing the labia together and why labiaplasty is so effective for making that tissue significantly smaller. Now it's kind of more in a tissue plane with the labia majora, so it doesn't stick out as much. And because it doesn't stick out as much, it's not on the outside and it's not rubbing and sensitive. I'm not saying that people don't see it, it's just not so prominent. And the goal, again, is to make people look like they were born that way. So we just go through this process on both sides, putting it right back together. They do have a scar on that edge, but this body part just heals beautifully. There's a lot of vascularity here, so it hides the scar really nicely because it's kind of not an even smooth surface. It's kind of a nubbly surface, so leaves a really pretty scar. And again, these stitches are completely buried and hidden, so you're not going to be seeing them or feeling them on the outside. But just to give you an idea of how we pull this tissue back together in a labiaplasty, we have some stitches that are deep inside, and then we have some stitches that are right underneath the skin edge. But we put those two inside and outside edges together all the way from top to bottom, and we create a much smaller labia. So when they've healed, they're more comfortable because they don't have as much tissue catching and pinching and rubbing. And it's a very private, very beautiful surgery. It's not on the outside, but it makes a big difference in people's daily lives. tell everybody that I see, my goal is for them not to have to think about their labia when they don't want to. Nobody should be having to worry to go and tuck things in the bathroom so that they can cross their legs in their meeting. So this will be our last stitch on this side. And you get an idea of how we get that tissue back together and significantly smaller. And then we do the same thing on her right side. We're not getting up into the hood. That's not part of this plan. But we are trying to arc down naturally from the hood so that it just looks like instead of winging out, it just kind of kept going south. And there's a lot less prominence now. And the patient's completely comfortable. We're just chit-chatting, talking about our favorite Netflix shows. But they're not feeling anything other than a little bit of pressure. They're not feeling any discomfort. We test pinch them before we start doing anything with the forceps. So if they need a touch-up, I go in where I know they're already numb and put it where we need it. But we aren't going to start the actual procedure until we know they're completely numb. So it's really well tolerated. You know, if you're not taking any medicines that make you loopy, which that's an option, but if you don't take any of that, you can even drive yourself home. Or you can bring a driver and not have to drive yourself. Just a couple more stitches on this side. And these sutures dissolve, so we don't have to go back and take them out. We just kind of let your body scar itself together and the stitches dissolve in that time, and then there's no more sutures and just the healed tissue. So there's nothing left inside of you to bother you once it's all absorbed. But the nice thing is we don't have to take your stitches out because nobody wants to do that. Do one more stitch down here. And if you look at the before and afters on the computer, on the website, you'll see that once things are healed, and most of those photos are 1 month photos, so it's not like they're a year later. Things heal up very nicely over that month. You have to kind of avoid doing a whole lot of lifting, pushing, pulling type activity, but otherwise people are having pretty normal days. So that is a very simplistic way of showing how we put the tissue back together. Now these labia are much smaller, and they don't protrude outside beyond the labia majora so much, so there's just not as much there that can tangle and irritate them while they're going about their day.